Hey guys, this is Peggy and we are at the 5th annual LE&RN 5K run walk, and I'm here with my favorite vendor, Juzo. This is Steve. Hey Steve.
Hi, how you doing?
And you work with Juzo.
I do. I have for coming up on 10 years now. Yeah.
So tell us why Juzo is so amazing.
That's a good question. How much time do you have?
I know.
Yeah.
I know. I agree with you.
What makes Juzo amazing? Let me see. Well, it's not just, it's a family-run business owned by women, which is really important these days, obviously, political reasons. All the fantastic colors, all the prints, and all of the fantastic fabrics that we have. What really sets us apart is we have, the most containing fabrics on the market. Everything we do is machine washable, machine dryable, latex free. God, I could just go on, forever and ever about the quality of our products.
Can you get my leg? Is my leg in the shot? So today, can you stand down? Today I'm wearing my beige Juzo. Last year I was sporting my blue one. So I love the colors. I love that that if there is a problem, you guys jump on it and fix it, and they're comfortable and they don't leave my skin rashy. You want to talk to us about the silver line?
Sure, yeah. The silver line helps with all sorts of skin conditions, especially surface cooling, antimicrobial, antibacterial, and it helps with like I said, any sort of skin issues that you might have that other companies don't have. So we offer that silver as just an extra added benefit to our fabrics.
Right. So if you don't wear a compression garment, you don't understand how important it is. But when it's 100 degrees outside and you're wearing, it doesn't matter if you have sensitive skin. If you're wearing a compression garment all day, it's uncomfortable. And the silver line, for me personally, has really been a godsend.
Sure, absolutely. Even with all our fabrics, we use what's called FiberSoft and all of our garments. So it really feels like it's moisture wicking in the summer. I've never had any issues with like sweating or anything like that. So when people always talk to me about, well, it's summer, I need an open toe, or I need this fabric or that, I need a thinner fabric or a sheer or something like that, it's just not true with Juzo.
No, and you saw mine. Mine's the big heavy duty, hey, I'm wearing a compression garment today. But it keeps me active and I'm out there doing stuff. I'm on my feet. I'm a professional photographer, so I'm on my feet all the time, and without Juzo I wouldn't be able to be so. Sure. I love you guys. And I'm so glad that you're here. I don't know, let's step back and let him take a picture of the some of the different fabrics and colors. Hey guys, we are with Melissa now. She's from Sigvaris, and tell us a little bit about your company.
So we're the #1 global leader for compression out of Switzerland, and we've been around for 150 years. So glad to be here.
Perfect. Now, do you personally work with patients, or are you more in their marketing, or?
I work more with distribution, so you'll see us at many different pharmacies and DMEs in Los Angeles County. As well as CVS, a few CVS stores.
So you have a lot of over-the-counter compression that people that don't need a custom garment can go in and just get an over-the-counter compression?
Exactly.
Now, do you also do custom fit?
We do as well, yeah.
Perfect. Thank you so much for your time.
Thank you.
Thank you for being here at the 5K Run Walk.
Thanks for having me.
All right, bye-bye.
Take care.
Hey, we're here with Julie, and she's from Dr. Granzo's office. And go ahead and tell me a little bit about his practice and what he does.
He is a plastic surgeon. He's a microsurgeon, so that one of our specialties is lymphedema. That's why we're here today. He's also got a cosmetic practice as well. We're in Torrance.
Now, you guys are one of the leading lymph node doctors, am I correct? Yeah, you're like a world leading surgeon, and I'm stuttering here. Sorry, guys. But yeah, I spoke with him last year, and he's going to be here later today, right?
He'll definitely be here.
So maybe I'll get to catch up with him.
Absolutely, we'll make sure that you do.
Perfect. So if not, what do you want our viewers to know about your practice?
That we help a lot of people, and that we have a number of patients here today for Team Granzo, and I hope you'll get a chance to meet them, because they're the ones who are our best PR. And they really do show you that that surgery can help, and Dr. Granzo has helped them, given them a lot of hope.
Cool. Maybe we can talk some people into talking with us with him.
I would love it.
All
I'd
right.
be happy to get them to you.
Well, perfect. Thank you, and we'll see you later today. Thanks for being here.
Absolutely.
We are here at Dr. Amron's table, and do you ladies work with him? You do. Now, he actually specializes in the lipedema, but he also works with lymphedema patients. Am I correct on that?
Yes, that's correct.
Tell me a little bit about what he does and what you guys have seen.
Well, we treat lipedema, so that's something that we specialize in, and we've got great results from patients all over the world. So thankfully, we treat them with lipedema and with lymphedema as well.
He's one of the leading lipedema surgeons in the world, and he's been doing this for some time now.
Yeah, that's over 25 years. We're doing about almost more than 2,500 surgeries on lipedema.
That's amazing because, lymphedema and lipedema, when I was diagnosed, it was like, nope, it's hopeless, there's nothing out there. And there really is, there is hope. We're never alone, and there is hope for us.
Yeah, that's correct, yeah.
Perfect. Well, hopefully I'm going to be able to catch up with him when he gets here. And I hope he has his cute little German Shepherd not little. I hope he has his cute, huge German Shepherd with him. All right, guys. Thanks for being here. Okay, guys, we are here with the USC table, and Kim is going to tell us all about the cool stuff going on here.
So my name is Kim Green Williams, I'm here representing at the beach from Keck Medical Center, USC. Dr. Keaton Patel is, yes, and we have hand sanitizer, so you can be clean all the time. But Dr. Keaton Patel, he does our lymphovenous bypass surgery. And there are only a few of these doctors in the world who even perform what he does. And we're out here to help the community those who are struggling with this.
We really appreciate you being here and being a presence here at the 5K run. Thank you so much. All right. Thank you. So before I go, tell me about this.
So we also have our breast doctors, Dr. Alicia Torondo and Dr. Maria Nelson, and for those patients who have had breast surgery and have their lymph nodes removed, there might be some swelling, and they work closely with our plastic surgeons. So we just want to let everybody know about them as well, and that could be a condition that could develop.
Right, because secondary lymphedema due to lymph node removal or radiation is very, very common, especially in women, but in everyone. So this is good to know that you have doctors that work together to treat the whole issue, because you think, oh yay, I survived breast cancer, and then all of a sudden now what? And then so you have a whole team that works together. That's amazing.
We have a multidisciplinary team at Keck to treat the patients as one, so they can come to the clinic and see all the doctors, as opposed to having 5 different appointments. They can see all those doctors when they come. And yeah.
That is awesome. Yeah. Thank you so much. All right, we'll talk to you again soon. All right, we are here with LymphaPress. All right, ladies, tell me about LymphaPress.
It's a pneumatic compression device, great for patients that, the compression, elevation, exercise aren't really working. We deliver it to their home, so they use it like once or twice a day for about an hour, and it's a great alternative, basically.
So it's a reduction. If you're having problems and you're needing to reduce, this pump is amazing. And you come to the home and you teach us how to use it and the whole deal. Perfect. What was your name?
My name's Jordan.
Stephanie, thank you so much for being at the 5K and talking to all of us. All right, thank you. We'll see you soon. Tell me when we're ready. All right, we are here with Luna Medical, and we have, oh my gosh, Myanna and Alec. And so, Myanna, tell me a little bit about your company.
Yes, for 25 years we've been providing medical compression for lymphedema patients. We pride ourselves for having insurance contracts so we can advocate for patients' insurance. So we provide all the manufacturer's products, and we can help the patients get the products that they're entitled to.
So if as a patient, we're having problems with our insurance, you can kind of go to bat, and you kind of have people that kind of understand insurance, and you can kind of help us get what we need?
Yes, we have a team of patient advocates at our office. Our main headquarters are in Chicago, but we work with outpatient lymphedema treatment programs all over the country.
That is amazing. And thank you for being here today representing at the 5K. It was so nice to meet you. Thanks, dude. We'll see you. Okay, we are here at the LE&RN 5K, and this is Judy, and she's the one responsible for blinging my face and my arm. She is here, and you work for LE&RN. You are on the board. You're a volunteer.
I'm a volunteer for the California chapter. I'm the chapter secretary, and we are just blown away by the number of people who are here today. It's so exciting.
This is so exciting, and you are my Facebook friend, but now we get to be for real friends, and that's the fun thing about coming to events like this, because lymphedema is a very isolating condition, and a lot of times you feel like I'm the only one in the whole world that has this, but we're not. I mean, look around. This is awesome. Thanks for all you do. All right.
Thank you.
We'll see you, Judy. All right, we are here at the Jobs display, and we are here with Kristen.
Hi.
And tell us a little bit about your company and how you got involved with this.
All right. Konrad Jobst actually was a German engineer, and many years ago he created this company because the only time he found comfort was in the swimming pool. So he had to figure out how to replicate hydrostatic pressure on land, and thus the compression stocking was born. We manufacture custom flat knit garments for patients with lymphedema. We have ferro wraps that are adjustable, and we also have night garments, Jovi Pack and the Relax. I got involved 16 years ago as a part-time position, calling on physicians and educating them on compression, and it just evolved, and now I handle all of the lymphology advising for Southern California and Las Vegas.
We appreciate anyone that talks to doctors and educates them so that we don't have to do so much work.
Yes, absolutely. And there is a big learning curve out there, so it's all about awareness. So that's what we strive to do.
Thank you so much for supporting the 5K, and I know you guys are huge sponsor this year, and we all appreciate you.
Thank you so much.
Thank you.
Thank you.
Bye-bye. Hey, Amy. I haven't gotten my goodie bag yet.
Oh well, here
I
you
haven't
go.
gotten registered, so let's go through the let's go through the goodie bag. I know we got lots of goodies this year.
We are going to have all kinds of good stuff in here. We have a therapy band.
Yay!
Thing.
Ah.
And then BioFreeze. I don't know if you've used this or not.
I have an athletic child, so I actually know all about
This stuff, when you have sometimes your legs just get sore,
Uh-huh.
and you put it on there and it goes
It's
away.
pretty good
Fabulous.
stuff.
And
All
then
right.
You can go, well, you've already
Every booth,
visited.
every booth has stuff. And let's show off our
Go
t-shirts.
check out t-shirts.
All right. I'm gonna pull one up. All right. So Amy's trying to get out of the camera.
Oh, sorry. No, I thought you
So all right, Amy, thank you.
Okay, you're welcome. Bye.
All right. So I need to grab my bag and my shirt before you guys run out. So a medium. I did grab my t-shirt. Okay.
If you want more wraps,
So are you guys ready to talk to me?
ready to talk.
What's your name?
Lisa Gainsley.
Pam Ross.
Hey, Pam.
Hi, Lisa.
I don't know. Hi, Lisa. Hi, Lisa.
Hi.
Oh my God. You're not Facebook friends.
I'm not on Facebook, but I'm on Instagram. The
Oh.
lymphatic message. So
Okay,
you can-
well, find me because I'm Facebook's just kind of
Yeah.
Over it.
I'm just only Insta.
Okay. All right. We are here at the 5th annual 5K Run Walk, and tell us about what's going on here at the registration table.
We are registering people for the Lymphatic Education Research Network Walk to bring awareness for lymphatic disease and disorders and bring a cure for early prevention.
And what are you doing here today? Just having fun?
Absolutely. I am trying to serve a purpose here, registering people and telling them to get their t-shirts, visit all our vendors.
Because I've been out doing interviews, and I just realized I had just now grabbed my goodie bag and raffle tickets. So what are we raffling off today?
Prizes, and
Food's always good. Movies?
soaps and other good things for your body, and just surprises.
Thank you both for being here and doing this, because I know this is a fun job to get to set all day while everybody else is walking and chatting. So thank you for doing this. We love you. All right, bye. All right, look who I found, guys. We have the president. You're the president?
Yeah,
the president and CEO of LE&RN. Thank you for doing this. I am going to give you the mic, and you can just tell us anything you want to say. I put you
Okay,
on the
well,
spot. No.
yeah, you did put me on the spot here. I don't know exactly what you want to hear, but obviously we're here in California for our run walk. This is so critical to what we do. I mean, we are a pretty expansive organization as far as having chapters all over the world, but we operate on a very small budget. So one thing we know we certainly need to do is for all the people that have this disease, we realize only a fraction of them seem to realize the name of the disease or getting help. And part of what we're doing here is making sure as many people as possible understand that they actually have lymphedema and begin seeking out the services they need to help repair their bodies, but also to do the level of advocacy needed so we can find a cure for this. And the only way that will ever happen is through public engagement and demands on the part of the community to actually fund research for us to get there. And right now we are very low on that totem pole of interest, and that's why we do our lobby days in Washington, D.C. and all the advocacy that we do and events like this, because the only way to get up here is for people to realize, I deserve this, I demand this has got to happen.
And I know last year when I talked to you, I got super emotional because LE&RN was just so critical. You know, I've had lymphedema for 21 years, and it took 8 years before I was diagnosed. And people think there's no information now. Well, 13 years ago, there was really no information. And LE&RN had this website page that was just words. It was just, but it was just so vital for me. I, hung on every word, and, you guys are so important to everybody, and, educating the doctors. I mean, that's what's really sad is that we have to we have to advocate for our doctors to know what's going on, and you guys do so amazing with that.
You know, there's a person here today, Beth Boyd, that we gave an award last night at a little reception that we have. And Beth is the chairperson of the American Society of Breast Surgeons. And she had arranged for Kathy Bates and myself to speak at their conference 2 months ago. So you've got 2,000 surgeons in a room listening to Kathy say, I want to ask you to do something I have to do every day in my job. And that is to crawl into the life of someone else to understand what their journey is like. I do that as an actor, and I'm going to ask you to do that as I tell you the story of my life of living with lymphedema. And it was interesting to see surgeons who beforehand said, you do realize we're surgeons. Nothing phases us. Our eyes roll back on our head. And instead, people came up after and said there wasn't a dry eye in the house. And to have surgeons come up and point to the screen where she'd put up the photos of people who had lymphedema and have them say, are you telling me the operations we do can lead to that? We're mortified. And you realize for the surgeons very often, they do the surgery, they discharge the patient, they don't follow up. The lymphedema occurs sometime long after, very often. They stay pretty well disconnected from the disease. So before the speech, there were doctors saying, I wouldn't do early surveillance or use a bioimpedant device, even if you gave me one. It cost five minutes for each patient to do that. I don't have that kind of time. Afterwards, there were over 350 doctors who picked up our flyer to do our continuing medical education course, 7-credit course that we gave them for free in lymphatic diagnosis and treatment. And now I'll mention, when I speak later, Beth is working with all the other societies to pressure the accreditation groups to only accredit institutions if in fact they do early surveillance.
Good.
So
that's awesome. And that's because you donate, that's because you get involved, that's because we all came together and said enough is enough.
Thank you.
Thank you. You're awesome. Thank you. We are here with Patrick. Patrick, you're going to tell me about this cool harness that you're wearing.
I will, yeah. So this is the FlexiTouch system. I'm wearing the garment for patients with head and neck lymphedema. Of course, we can treat the whole body. It's a once daily treatment the patient does at home to essentially do their self-MLD at home.
That's nice because, I do it the old-fashioned way with my hands, and it's just not that fun after so many years. So this looks like a pretty cool contraption. So is it similar to a pump then, or tell me how this works?
So it is actually a pneumatic compression device, a pump. It's a once daily treatment the patient does that's proven to reduce the risk of cellulitis by 79%. How it works, it channels air through the individual channels in the garment to essentially simulate the MLD that they're going to do in clinic. It's the most clinically proven device on the market. It's fantastic. Patients also love it. It's like a light rhythmic massage. That's us right there.
This is for arms.
Uh-huh.
This is pretty sexy. You know, I have a lower lymphedema, so I'm all about the leg garments. They're gotta look sexy sporting that. Check that out.
Now you can see, we were discussing, each of the individual chambers on here are going to inflate one at a time to essentially help milk that fluid back up and out of the patient's affected limb. I mean, the net effect is a resounding reduction in the rates of infections, in the rates of wounds that don't heal, especially in our lower extremity patients, and improvements in quality of life. Because at the end of the day, that's what it's really about, right?
You know, this is a tough condition to live with. I've had it for 21 years, and it's time consuming. There's times that I spend 4 hours a day just being able to walk. You know, so things like this are, you know, the average person doesn't realize how much this does help with our quality of life.
For sure. And you know, it's funny, I'm wearing the head and neck garments right now. It actually couples with this guy right here, right? Those patients especially, I feel so badly for, because we're talking difficulty chewing, swallowing, breathing, speaking. And when I get to work with them and see the kinds of improvements that they have in those quality of life measures, goodness gracious, I both love and hate it. I really do.
No, I completely understand.
For sure.
Well, thank you so much for being here and telling people about this. And thank you for giving me the winning lottery ticket.
Numbers.
All right. We'll talk to you soon.
Sounds good.
We are here with Dennis, and you represent Sozo. So tell me, this looks pretty exciting. Tell me about this.
So it's a company called ImpediMed, and our latest generation product is called Sozo. It measures the fluid in your limbs so we can pick up lymphedema before there's any visible swelling.
Wow, you just blew my mind. So doctors can actually use this if there is a chance.
There's a chance of lymphedema to monitor, catch the accumulation of fluid before you know it's there. And then the treatment is an off-the-shelf compression therapy for about 4 weeks. And studies have shown that 95% of those treated early like that will not progress on to chronic or clinical lymphedema.
Because this is Dr. Peggy here. No, I am not a medical doctor, but this has always been my opinion that you have lymphedema before it shows.
Before it shows up, yes. It's called subclinical stage 0 lymphedema. You can't tell by just looking, right? Because you can accumulate quite a bit of fluid in your arm or your leg until it starts to visibly swell.
Because you're basically like a sponge. And, you know, a sponge can hold water before it
swells, right. And we can pick up as little as about 2.5 tablespoons of fluid difference between your limbs.
I'm about to cry right now. I didn't even know this existed. And I've always been such a, you know, because it took so long. I was having issues before I swelled. And then once I started swelling, it was 8 years before I was diagnosed. And then it was, you know, I had fibrotic tissue. I was a mess by then.
And we hear that all the time, that people know that there's something wrong, but it's just not diagnosed, misdiagnosed. It's just water retention. It's just weight gain, right? Just, you know, put your leg up, put your arm up. You'll get better, right? And you don't. If not treated early enough, as you know, it's a progression that just gets worse.
They ask me to do interviews, and they don't know how emotional this place makes me. I'm usually pretty cool, but no, I'm literally so excited that this exists. Thanks for coming and sharing this with us.
Thank you.
Now, how can we encourage doctors to test for this? What I know I was just talking to William, and he's, you know, they really are trying to get doctors to know about this. But what can we do? Just support LE&RN and support what they're doing, or what can we personally do to get this knowledge out there?
Talk to your doctor. Like you said, talk to anybody and everybody. Talk to your doctor. Talk to everybody. You know, that's what we're trying to do through LE&RN is just the awareness. People who this is for secondary lymphedema, right? It's a result of cancer treatment. So any cancer, you know, your surgeon should be telling you about lymphedema before the surgery, right? They should be getting a baseline reading. They should know where your fluid levels are before, so they can monitor you after the fact and pick it up early. It's the patient education beforehand that's crucial, and that doesn't happen unless the surgeon knows about it, right? And knows that this is something.
We're going to get this.
We're going to get this. It's just a matter of time. But
thank you. Thank you. Hi, we're here with Dr. Jamie Swartz, and you're a Beverly Hills doctor.
Sorry. I'm a board certified plastic surgeon. I do practice in Beverly Hills, and I do treat a lot of lipedema. I think it's a very important thing that we work on. And so I do a lot of lymphatic sparing liposuction. We've developed techniques for lymphatic sparing thigh lifts and arm lifts and things to really help people. So
That is awesome. And how long have you been doing this? Working with lipedema and lymphedema?
been treating lymphedema over 10 years, lipedema probably at 7 or 8 or so. Yeah, it's been a long time. The reality is, even when I was treating lipedema at first, we weren't really sure what it was, and now that we learned over time, now we're really been getting better at it. Yeah, so it's been a long time.
Right, because a lot of people weren't and still aren't diagnosed. It's like, well, you're just fat, lose weight. What's your problem?
Exactly. So actually, one of the hardest things is people come to the office, and I wind up diagnosing them. They've been to every doctor, their primary doctor, they've done everything, and I have to explain to them what it is, and then we have to get them in the system. And that's really, it's almost like grassroots, which is a hard way to treat problems, but we're getting there slowly.
Thank you. We appreciate you coming out today, and we appreciate all you do for the community.
Thank you.
Thanks. I want to interview Gunther. So we are here with Gunther. Oh, wait, no. We're here with Dr. Amron.
And Gunther. And Gunther.
So, Dr. Amron, you are a leading a surgeon for lipedema. Tell us about your practice.
Well, I've been in practice.
I pet this amazing man right
I've
here.
been in practice 25 years. My practice focused on liposuction for all that period of time. And in the last 15 years, it's been very devoted to lipedema. I've done over 2,000 lipedema surgeries. And I just love it. I love helping patients and changing lives, and it's just an amazing thing.
That's awesome. Now, last year, your son won the race. Is he here?
Did he really win the race?
We're calling it.
I got to tell you, in the LA Times this morning, which I was reading at 6 a.m., there was an article about cheating on the marathons, about how people get.
Are you calling your son a cheater?
No, it just kind of brought up like this. Well, he says he does a 6 miles in 24 minutes. And I find that a little hard to believe. He's 8 years old. It can't be, right? 4-minute miles consecutively. So I don't know. Hey, Ben.
Where's Ben?
Come here, Ben. Come here. Ben.
Come here.
I think, come here.
We got to talk to you because you won last year. Your dad is. He's like, I'm not doing it, Dad.
No,
You're slamming me.
I'm not saying my son's a cheater. No. But
saying that he's a very talented young athlete.
He actually is very fast.
Yeah.
He is good. Yeah. But there's some good runners here.
There are. This is fun.
I know that, and it tests me.
Yeah.
Because I'm getting older, so I can feel it in my joints.
Well, we appreciate what you do. I guess we're going to get started, so I'm going to get out of here.
Great. Thank you so much.
All right. We'll see you
running?
soon. No, I'm not. We are here with Tina, and you work with Dr. Amaron?
Yes, I work with Dr. Amaron at the Roxbury Institute. I am the MLD therapist. I do the post-op care for his lipedema patients.
But what's super interesting is you are also an acupuncturist.
Yes, ma'am. I'm currently pursuing my doctorates in acupuncture, and my capstone research is actually on using acupuncture for lymphedema.
And what are you seeing with that? That is amazing.
There is a physician at USC Keck Medical School who recently did a presentation on the latest research on acupuncture for lymphedema. And the research indicates that if we focus on using acupuncture points on something called a triple burner meridian, if we focus on that, it will help reduce swelling for lymphedema cases. So that's what my research is based on.
That is awesome. Thank you so much. And are you on social media? Can people follow you?
Yes, I am at Harmony Lymphatics.
Perfect. All right. Thank you so much. So come stand with me. All right. So we're getting ready. I'm here with Kathleen Listen, and they're getting ready to start. Everybody's gathering together to hear the speaker. Do you know who's speaking today?
I hope it's Amy Rivera.
Yeah.
I drove all the way up here to see Amy Rivera.
Yeah. Are you kind of like the leader of her fan club?
No, she has a lot of fans. But I was just really amazed to see her before and then the surgery with Dr. Granzow, and then I've only seen her once since then, and it's just amazing.
It's amazing.
Like, it's the dream come true for a lot of people to have that level of swelling with primary lymphedema and then have such an amazing change in her life.
Yeah. Well, let's go see who's talking. Let's go. All right. Dr. Granzo, it's so good to see you again this year. So I've been walking around interviewing people, and boy, you are quite the buzz around here this year.
It's just everybody's. It's really a real pleasure to see everybody who's come and so excited for the event. It's they invite themselves, and it makes everything that we do worthwhile each day.
Right. And I know it's, for somebody that lives with lymphedema to see somebody that doesn't live with lymphedema actually care, because we are so used to doctors and people blowing us off and telling us, oh, you're just fat, or you're just this, or you're just that when we see a doctor that actually wants to help us and not just give us a pill and send us on our way, it's amazing for us. I don't know if you realize how impactful. Not only are you one of the top surgeons in this field in the world, but you care, and then that shows.
We're very blessed that we have a job that we could go to every day and make that impact. It is that, and we really hear that everybody. We have someone tell us how much we impact, and it really impacts us back. It's a fantastic thing.
Well, we all appreciate you. And is there anything you want to tell us about your practice?
Just we're really blessed to have wonderful patients who refer each other. There's a little network group, and they're all connected to each other. So it's not just us; it's about them.
Well, we love you, and we appreciate you coming out here to this 5K. We'll talk to you soon.
Thanks for talking.
All right, bye-bye. Okay, we are here with Amy, and she is the founder of Lymph Ninjas, but a whole bunch of other stuff. So tell me everything.
I'm the ninja, actually.
Are the ninja.
I am the founder of Ninjas Fighting Lymphedema Foundation, but most importantly, I'm a patient myself. So
sexy garment on today.
We're a new fashion statement. My friends and I, we rock the compression. I actually was born with primary lymphedema, and up until September, my right leg was 200% larger than my left, and Dr. Granzo performed a surgery, and now I have a new leg.
And how is that?
It's amazing. I'm living life all over again.
You have like this brilliant smile on your face that's like you can see from across the whole field here.
Yeah, you can't take my smile away. Yeah, even with insurance battles, you can't take my joy away now.
Because you have a leg.
I have a leg. So, yeah.
That is so awesome. Now, how can people follow you on social media? Because you have a big social media presence.
Thank you. You can actually go to our website, winourfight.org, and it has all our social media links on there, our Instagram, our Facebook, and our Twitter.
Yay. And congratulations on the new leg.
Thank you. Thank you. Thank you.
All right. Thank you so much.
Thank you.
We are here with Dr. Eicher, and Dr. Eicher, you are amazing because you have lymphedema, you treat lymphedema, and I love your stuff because you talk about how important food is to maintaining health and everything. You have an amazing book, you've won some awards, so you've got a lot going on. So tell me about what's going on.
Thank you. I think my choice of education and follow-up was to be a surgeon. However, in my second year of residency in surgery, I developed lymphedema, which was secondary to the lymphoma treatments, radiation therapy, and double radiation therapy in those days, and chemotherapy. So consequently, I developed swelling in my right lower extremity, which then channeled me to take physical medicine and rehabilitation instead of continuing surgery. And 20-something years ago, 30-something years ago, 40-something years ago, nobody knew anything about lymphatic. They didn't know how to spell the word lymphedema. So when I came from New York to California, I met Professor LeDuc, one of the authorities in the world. He gave a course on lymphatic disorders and management of lymphedema. And there finally I met someone who knew about lymphatic system, and the treatment was research-based. So I followed his preaching, and I started to manage my own lymphedema, and eventually I channeled my lymphedema center in Santa Monica to treatment of lymphatic diseases.
Because a lot of doctors don't know what to do with us, and it's years and years have passed. It's 2019, and still the education is not there. But you help so many people. Now tell us about this award you got. I know you hate being put on the spot, but We're putting you on the spot.
It was totally unexpected. It was a wonderful, wonderful surprise for life achievement in the world of lymphology, lymphedema, by USC, and it was presented at the conference, second conference that Dr. Patel organized in Santa Monica, and we hope to have a more annual meeting and more attendees to learn about lymphatic diseases. And Kathy Bates, one of the authorities and spokesperson for lymphedema and lymphedema management, was there, and she gave me the award. So
special.
It was double special, triple special, and totally surprised.
That's awesome. Well, you deserve it. And we all appreciate everything you do for, and you're doing it for yourself, but you're in turn doing it for all of us. And we so appreciate everything. So
thank you so very much. And we hope that we will continue. This was our 5th annual walk
here in Santa Monica.
In Santa Monica, a beautiful, almost sunny Santa Monica. And we hope to meet all of you plus more next year.
Thank you so much. So good to see you again.
Thank you.